Hey everyone, I'm Dr. Chris Perron here at Perron Chiropractic in Reston, Virginia, only a few minutes outside of Washington, D.C. And in this episode of our learning series, I'm going to discuss with you vertigo. Vertigo, dizziness. From a practical standpoint, they're basically the same thing. From a technical standpoint, there's little nuances. Vertigo often can come with nausea as well. But in the end, you got balance issues. You're getting off the boat and things are moving and maybe the room's spinning and so on. And what that comes down to is in your ear, where we have a little pool of water that basically sets our where are we in space, and then it reports to your brain where you are so you know that you're steady, right? Well, somewhere along the way between that and your brain that's getting the report, there's a mixed message. There's a staticky phone line. There's right? There's that kind of phone call. And so your brain is going, where are we? And that ends with vertigo, dizziness, and all kinds of balance issues. Well, here's the wild thing. So it's in your ear is where this is housed. So you figure, well, it's already in my head, right? And that's true. That part is in your head. But the way your anatomy works is that nerve actually winds out of your head and to your upper neck, through the vertebra in your upper neck, and then back into your brain. So it has to pass by a few things, and it's those top vertebrae at the top of the neck that when they get shifted in just certain ways, and there's a specific pattern that most commonly goes with vertigo specifically as an effect, then that vertebra is kind of leaning on it. That's what it is, stepping on the garden hose. The full message is not getting through. And when we realign that joint, it can make a huge difference. It's affectionately known by a lot of our patients as the dizzy button. Why is it a dizzy button? It's a dizzy button because it's like an on-off switch. If that thing is flipped in the wrong place, meaning that joint is stuck and that vertebra is leaning right into where that nerve's traveling by, if you aren't dizzy now, you're probably going to be soon. Nice thing is we can find it and very precisely put it back where it's supposed to be as far as the vertebrae, and then that pressure goes away and message is clear, and hey, look at that, it's gone now. And it can be pretty darn fast as far as the effects. Now the key is we got to make it stay there, and so we make sure that you have the right exercises as we go through different things you may be doing in your day-to-day life that are creating this problem, because we want to make sure we get to resolution as best as possible, and in most cases that's completely possible. So vertebra out of place, certain way, certain direction, certain combinations, we know where to look. So if you deal with vertigo, if you deal with dizziness, or you know somebody who does, send them on in, come on over. Within a minute or two, we can actually do an evaluation to see if you have what all those other people have had before you. And if you do, and it's all likelihood you do, because there aren't a lot of other causes of it, but if you do, then your odds are excellent that we will be able to help you with this situation. So only one way to find out, like I said, so feel free to give the office a call, send us an email with any questions. If you found this video helpful, please hit the like button, as well as subscribe so you can find out about other conditions we take care of here at our office also. And again, I'm Dr. Chris Perron, and I look forward to meeting you.